It's been really great to see the growth that we've had in our pharmacy services, especially here at Stevens, where we've seen year-over-year growth. Tell us about how many scripts we see each year and kind of how that's grown over the last few years.
Absolutely. So I think that story really starts back in 2019. If you look at Bolivar as a community, at that time we had 7 retail pharmacy locations. We now have 3 retail pharmacy locations. So this team has had a lot of change and a lot of growth over that time.
Growth presents a lot of challenges, and one of the challenges was how do we keep up with all the prescriptions that we're seeing and difficulty finding more staff. And so we also invested in technology to be able to help with that growth. Tell us a little bit about the packager and the systems we put in place to be able to facilitate the growth we've had.
This year we've added a pharmacy packaging system that allows us to bottle our prescriptions. We send about half of the volume through that packager now. So instead of having techs on the front line counting out prescriptions, we're able to automate that process safely and effectively for the increased volumes.
So how many prescriptions do we fill per day here at Stevens?
So that number continues to change every week. Here, after the Evans acquisition in the last couple of weeks, we've seen numbers over 1,000 every day.
So we recently had some news of acquisition of the Bolivar and Buffalo locations of Evans pharmacies, and really that fits in line with our strategic plan to be able to increase access to medications for our patients, not only here in Bolivar, but in all the communities we serve. And so Evans was great to work with. Tell us about that transition and how it's going.
So we've had a whirlwind the last couple weeks getting all of that settled, but we did welcome 11 new staff members to our team, both here in Bolivar and in Buffalo. And we're very grateful to have access for our patients now in Buffalo to CMH Pharmacy Services.
One of the things I'm excited about with the addition of the Buffalo pharmacy is just how we can integrate the operations of the community pharmacy with our medical practice there in Buffalo. You want to talk more about the clinical services that we provide right now in our clinics?
We offer services like walk-in immunizations Monday through Friday and even on Saturdays. We have a med synchronization program that has really helped us sustain the growth that we've seen over the last several years. It's not just automatically filling your prescriptions, it's a conversation with you about what changes you've had with your medications. Have you been to the doctor's office in the last month or 3 months, depending on how frequently we fill your scripts, and making sure that we're incorporating those changes into what we're doing for your pharmacy needs.
Early on, one of our growth strategies was to partner with the FQHC Ozark Community Health Center and be able to provide pharmacy services in Urbana. And we've got a really unique model there. I'd like for you to tell us about what that model looks like in Urbana and how we've integrated that with their medical practice.
So we're using telehealth, video equipment, audio equipment to monitor the work of a pharmacy technician at that remote site with all of the pharmacist verification happening here in Bolivar. So it's a really innovative way to bring pharmacy services to a community that wouldn't otherwise have the volume to sustain a pharmacist all day.
Right now we see in the news there's almost a drawing back of pharmacy services, especially in underserved areas, rural areas. At the same time they're doing that, we're seizing the opportunity to provide more services, and I think that really speaks to our commitment, CMH's commitment to these communities, making sure that they not only have health care in their community, but they have the best health care and access to professionals, not just their primary care physicians, but also to pharmacists and medication management.
In addition to those services, we also spend a lot of time making sure that patients can access their medications.
Yeah.
A lot of work goes into our drug discount program and making sure that if there's someone that's going to go without, we find a way to make sure that they either get a different prescription from their physician that still meets their needs, or we put them into a program that allows them to access their medications at a price that they can afford.
Thanks, Mariah, and it's really great to see all of these growth opportunities that we've been able to see happen in the past, and I know we've got a lot of vision for the future. And really, this just fits in line with CMH's mission and vision to provide compassionate care to all of our communities, to have the safest, the highest quality care. And pharmacy plays a big role in that. And I appreciate what you're doing, appreciate what your team's doing to help us achieve our vision for our communities.